Very warm welcome to everybody who's joined us, and you'll have noticed that we promoted this happy hour at very short notice. We've had nearly 200 people sign up, so well done to everybody who's managed to join us today. You may not know, it's actually our 125th happy hour since we kicked off during lockdown. And in fact, one of our first ever events was in partnership with one of our guest speakers, Paul Smith. Paul, you may remember when we held the annual conference, a virtual conference, soon into lockdown. So great to have you back. But we have a great programme for you this afternoon, which is really going to unlock and look at some of the things that are really starting to strive to take forward post the Older Persons Housing Taskforce and a number of other policy initiatives. And we're really delighted to sort of talk about suitable housing for an ageing population, or as we call it, the SHAPE programme. This has been really pioneered by the partnership that we're developing with the Vivensa Foundation. And how better to start off with both Susan Kay, who sadly announced this week that she is a departing chief exec, but we're also super delighted to have Katy Saunders, who's the incoming chief exec, to kick us off in a minute. They will be joined by Rose Gilroy, Professor of Ageing, dear friend of the LIN over many years, and also trustee of the Vivensa Foundation. Followed by Kevin McGeough, Head of Strategy and Placemaking at Ebbsfleet and the Development Corporation there. Kevin, you've been a real champion over the years with ageing population issues and really embedding that now within the context of a new town. And you're going to be looking specifically at more around intergenerational behaviours and living in that type of community. And Paul, back to you at the end to think much more broadly around not about new build, but how do we adapt and improve our existing stock? A real big challenge in terms of our housing stock in the UK. There'll be some time for questions and answers. Please, as Sally says, put your questions into the Q&A box and we will go through those later on during this happy hour before we close at around 5 o'clock. So without further ado, can I pass you over to Susan Kay and Katy Saunders?
Thanks, Jeremy. I'm not sure how we're going to appear on the screen together, but I'm going to be talking today, and I'm going to be introducing you to Katy a bit later on. As Jeremy said, she is going to be joining me at the helm of Vivensa Foundation at the beginning of December. We'll work together, and then she'll be taking over from the new year. But what I'm going to be talking to you today about is our exciting new partnership with the HousingLIN, as Jeremy said, the SHAPE Exchange. The Vivensa Foundation has for a long time now had age-friendly housing and communities as a social determinant of healthier later life outcomes at the centre of its mission of funding the remarkable science and the radical social change needed to help everyone to age well. Can we just have the second slide, please, Sally? Fast forwarding to 2020, just when we were adjusting to the new realities of COVID-19, we, with the Social Care Institute for Excellence and others, launched something called the Commission on the Role of Housing in the Future of Care and Support. And this called for a shift in how we view housing, particularly its role in contributing to health and well-being in later life. In this context, housing was not being thought of as simply a place to live, but as somewhere that would be integral to our well-being, our health and social connection throughout our lives. In the words of one of the commissioners, we don't want to simply create islands of the old, and that's why I'm so pleased that we've got somebody here today who's going to be talking about intergenerational living too. So during the last 5-year period, we went on to fund a whole body of work around creating age-friendly living environments of the 21st century and beyond. And you can read some of this in the links that I think Sally is going to post in the chat. They've included things like the development of living labs. We've worked with United St Saviour's Charity in Southwark on developing the community aspect of a fabulous Appleby Blue modern almshouse. And again at Appleby, we hosted a round of Socialudo's Serious Game that brought planners, funders, health and care providers, local authorities and the community together to plan their needs. And we've been working with the Open University and the Bangor Housing Association on identifying and addressing the housing needs of our increasingly diverse communities, as well as a range of earlier stage research on housing as a social determinant of how well we age. Can we have the third slide, please? So incorporating some of this work and much more, the report of the Older People's Housing Taskforce, which was so brilliantly chaired by Professor Julianne Mayer, and it published its report a little under a year ago now, outlined a vision for our future homes, housing that promotes well-being and strengthens the fabric of our communities. This vision is particularly important as we think about the diverse needs of older people and indeed communities which are becoming much more culturally diverse. It's not just about building more homes, it's also about adapting what we already have and using what we know about good design to create high quality spaces that offer comfort and security and the flexibility to adapt over time, and putting support structures in place that make good practical use of what's good about 21st century technology. But around the time that the Taskforce was reporting, we had a change in government. And while there's been a commitment to build more houses, the momentum and the more nuanced messages around quality and adaptability, about community connection and lifetime homes seems to have been rather lost. There are a number of us, however, who feel we need to take ownership of its recommendations and move that agenda forward with or without government support. We've seen decades of reports and recommendations calling for enabling regulations and top-down solutions, and these are important, but much more can be done at the community level. The great examples that exist need to be expanded and amplified and encouraged, not least to give others the confidence to do similarly. So we need to focus on showcasing and supporting the pioneers, the individuals and the communities who've had the courage and the will to make change. We need more evidence, more action, more collaboration, more flexible capital, and more innovative thinking. So I'm delighted that our flagship programme as an organisation, in collaboration with the HousingLIN for our next 5 years, will focus on creating resources, supporting and developing local leadership, and providing funding for a number of testbed locations to do just that. And while, as I said, I'm going to be retiring at the end of the year, I'll definitely be cheering from the touchline. And I'm delighted to be able to introduce you today to my successor, Katy Saunders, who joins us from social finance. And she's going to bring some really useful experience in supporting the delivery of social outcomes through innovative financial mechanisms, and is as passionate about this as I am. And she's going to be saying hello a little bit later. Can we have the 4th slide, please? So this programme, we're calling it the Shape Exchange. And by fostering partnerships with local authorities, developers, integrated care boards, community groups and others, with the voice of older people placed front and centre, we can build on decades of learning and recommendations to create more opportunities for housing and communities that truly meets the needs of us all. We're still working through the details, but essentially the programme is going to have 3 main pillars. The HousingLIN is already the go-to learning and knowledge exchange organisation for housing suited to later life. And this programme is about assembling that intelligence that's been developed over lots of years and to create the next generation of tools and resources to support policymakers, practitioners, architects, housing developers, health and social care providers, and so on, right across the UK. One of our key design frameworks in this area is, of course, the HAPPI principles, the Housing for Our Ageing Population Panel for Innovation, which has been in place for, well, nearly 2 decades now. And these principles of good design ensure that housing can adapt as individuals' needs evolve over time. But in the 21st century, we need to add technology to these principles, as it increasingly plays a pivotal role in connecting communities and supporting older people to live independently. Hot on the heels of the Commission on the Role of Housing in the Future of Care and Support, we funded and launched TAPPI, or Technology for an Ageing Population Panel for Innovation, which sought to explore how people could maintain their autonomy by leveraging technology to help them to do the things they enjoy and to stay connected in their communities. Through the principles of co-production, older people living in a variety of settings were empowered to shape the technology and the support that they needed, ensuring that these solutions were not just effective, but also aligned with their preferences and lifestyles. I think that when we set out on the TAPPI journey, we thought we'd come up with some principles that were like the HAPPI principles, some tangible things that we could give to product developers and say, look, you need to come up with something like this. But it didn't work out quite like that. The older people that were called to that programme So our co-production champions told us something quite different. They proposed a new set of what I think of as enabling principles: safe, seamless, affordable, and supported. Combining these how-to principles with HAPPI's design principles and all that we know about environmental sustainability, we believe we have the ingredients to construct a framework and a set of resources that ensures that the places in which we live can help us to thrive as we age. So central to this second pillar will be involvement. We'll draw on the learning and the delivery approach that we acquired through the TAPPI programme, working together with a range of existing older people-led groups to reinforce a new paradigm of co-producing meaningful solutions. And the third pillar of our programme will see the HousingLIN taking the lead on one of the Older People's Housing Taskforce recommendations, developing leadership. Attached to each testbed site will be a leadership set designed to bring together current and emerging leaders from a range of organisations, including national and local policymakers, housing, health and care professionals, academics, architects, designers and leaders of community-based organisations to support and foster leadership and cultural change in the creation of living environments and housing options for older people. So can we have the fifth slide, please? We've set aside £3 million to support this element of the programme. Each site will be able to apply for a portion of that. That's still to be worked through, to contribute to the development and evaluation of transformational approaches to providing wider and additional housing choices for older people that are grounded in their needs and preferences. This should include mainstream housing options, either new or retrofitted, that are designed to meet the needs of older people, as well as specialist housing such as extra care housing. All this should be working at the intersection of housing, health and social care, and in this way provide a link to the NHS's shift from sickness to prevention. Each of the leadership teams will become part of a learning set, as I mentioned, and that will have the support of the HousingLIN team as well as the Vivensa Foundation's Academy, the aim of which is to provide support for them in their journey and to capture the learning with a view to producing structured outputs that can be added to the resources and toolkits which are being built and curated under pillar 1 of this activity, so that that sharing can be shared, so that that learning can be shared openly and widely. So slide number 6, please. As I said, we're still very much working at the detail of this call for proposals, as well as approaching other funders. And indeed, if there are any others out there who'd like to join us, then please do contact us. We're likely to be inviting applications to host a SHAPE lab or a test bed towards the end of 2026. And we're planning on holding a number of information sessions in the lead up to that invitation for proposals going live. So what I'm saying at the moment is not set in stone, but what you're getting is the broad shape. But I did want to give you a flavour of the shape of things to come. So we're thinking about things, we want to be supporting the development of innovatively designed new homes, scaling already well-evidenced alternative modes of living, multi-generational communities or co-housing, homes designed using the TAPPI principles and using the enabling TAPPI principles. Development and adoption of a local plan which has been developed with the input of the local community, plus the housing, health and care agencies. Retrofitting existing housing stock to better meet the changing needs of older residents. Innovative tenure models that improve affordability and flexibility for older people. Can we have slide number 7, please? So integration, there's some more examples of other things that we'd be interested in as well. Again, as I said, these aren't set in stone. It's not just these, but these are to get the juices flowing and the ideas about the sorts of innovative designs and interventions that we'd be looking for in applications. And I guess we're going to be sharing these slides later on, so don't worry about having to scribble all of these bullets down. Can we have slide number 8, please? Our recent experience of supporting programmes of this nature, that is ones that have needed collaborative leadership, means that we'll be looking for evidence of some existing conditions in applicant teams and areas. These are going to be 2-stage processes, and applicants will need in the first stage to be able to demonstrate the following. A commitment to an approach that uses community-led identification of need and the will of leadership to address it with innovative solutions, or that it can demonstrate it's already taking steps to broaden choices and options for housing and support for older people. The ability to demonstrate a culture of co-production at the heart of all service design and delivery. It can demonstrate strong links with voluntary and community sector, and to provide evidence of active engagement with a wide range of housing providers that can deliver a mix of housing options suited to locally identified needs and the aspirations of older people. So they're the sorts of baseline things and the sort of collaborations and the strong will to do this that we're looking for first, before we will then look at what the intervention actually is that you're looking for support for. And just a few final things from me, if we can go to slide 9. For at least one local partnership who's actually ready to explore taking preventative, integrated, asset-based and outcomes-based commissioning approaches, we can offer you the opportunity to apply to our social financing fund. And as I mentioned earlier, Katy's going to be bringing her expertise and experience to this. As I also said, we're going to be providing much more information over the course of the next 12 months. But in the meantime, there are some things that you can do. If you're a social innovator, community organisation or a local authority that's working in providing innovative housing solutions like this, consider joining the Vivensa Academy, or at least sign up to receive updates from us. And you can do that via the front page of our website on the Stay Connected tab. And the last thing is, please very warmly welcome Katy. She joins us formally on the 1st of December. And Katy, do you want to just say hello?
Thank you, Sue, and hello, everyone. I'm super delighted to be joining Vivensa and to be part of this partnership with the HousingLIN. Their expertise in housing for later life and track record as a national knowledge network just makes them such a valuable collaborator. As Sue has said, the evidence is clear. We all know that where and how we live is one of the strongest predictors of health in later life. And yet, fewer than 1 in 10 homes meet basic accessibility standards. And we spend, on average, the last decade of life in poor health. So for me, this programme is really exciting. It gives us a way to work together to change that, combining Vivensa's research excellence, mission-aligned investment with the HousingLIN's practical insight and national reach. So I think we can really turn evidence into action through collaboration and local leadership. So really, really keen to join at this point, to work together and to build on what we know already works and work together to make it real for more people in more places. So look forward to meeting with many of you over the coming weeks and months.
Brilliant. Thanks, Katy. Back to you, Jeremy.
Well, both of you, thanks ever so. That's a really fantastic introduction. And Katy, you said you're super delighted. I think we are too, and I know the team is. And the only thing I would add for many people who are sort of thinking, oh, how can we access more information about this? This is not England-centric. This is deliberately to look across all the 4 nations. I'm not sure that came across, but I just wanted to reiterate that while we talk about the Older Persons Housing Taskforce, that's been a very pivotal driver for this. And I'm delighted that Professor May is actually one of our delegates today. But we're also wanting to make sure that we can see this beyond the England into all the 4 nations, and we're also, as part of that, pulling together an advisory group that will also represent those 4 nations as well. So on that note, can I thank both of you for your fabulous introduction, and I'm going to pass on to Rose.
Right. Hello, everyone.
Lovely seeing you. Thanks very much for joining us this afternoon, as well as someone who will continue the link with Vivensa, we hope, in the new programme.
Indeed, right. Good to be here, everyone. Thank you. So I want to talk in my brief time slot about care-ready housing and just reminding us about the dynamism of life, not just later life, but all of life. And somehow when we're thinking about housing, this is not something we're necessarily thinking about. How does our housing fit us through the various parts of the life course? So next slide, please, Sally. Okay. So when I think about care-ready housing, I think this is a three-legged stool standing on design, technology and community. But if you want the seat of that, one of the most important things is to think about the voice of older people and to keep listening to older people. And I think, again, we need to remind ourselves that old age is a time of incredible diversity. I'm very fond of Joseph Coughlin's idea that when you're in your mid-60s, you've got about 8,000 days to live. And you can split this roughly into 4 phases: the honeymoon phase, the making the big decisions, navigating longevity, and the solo phase. And these represent perhaps changes in your health, but certainly changes in your needs. And because later life is not just about need, it's also about aspiration. The things that gave you joy and you wanted in your middle 60s are not necessarily the same things that you might want some way down the line. And I think also we need to remind ourselves about the diversity of later life and keep talking to a diversity of older people. I hope we've all exploded the idea that old age is one thing and you think, get over yourself. Later life is cross-cut by gender, disability, sexuality, ethnicity, faith, family circumstances, care responsibilities, health, wealth, income. All of these things make this a hugely diverse and dynamic experience. So let's keep listening to older people. And I think one of the things that came out very strongly in the Taskforce was the voice of older people expressing preferences for example, remaining in their own home, but also the admission that a lot of people simply don't know what's out there. So there's a failure to communicate, or maybe there's a failure to excite. Because if you're going to get somebody to move from something that they've lived in for 30 odd years, it's got to be aspirational. It hasn't just got to be, well, I guess it's okay. You really need something that's going to excite. So let's then push on to the issue of design. And can I have the next slide, please, Sally? So I say I've kept myself to a small number of slides here because I'll probably elaborate around. And as Sue has already mentioned, we're not standing from a zero base here. We have the HAPPI principles, and I was going to ask Jeremy when that is, and Sue has said it's nearly 20 years. Good grief. So, this has been informing the provision of retirement housing. There's obviously still a way to go, but a lot of people, I think, have embraced these kinds of principles of what works. But, and this is where I get on my little soapbox, I think Sue alluded to this at all. Why has the debate about housing come back to numbers? I think with the last government, I think I'm right in saying, I think we'd won the argument that M41, which is the visitability standard, was not great. Having said that, there's not a lot of our housing is actually at M41, so it might not be fabulous, but we haven't hit the mark. But, let's be more ambitious for our housing. Let's go to M42. And the last government ran out of time. But this government has gone back to talking about the numbers of housing, as if quantities was the entirety of the debate. So we obviously need to keep pushing this. And if you want to read something, and I think Sally has put this in the chat, you might look at the Viewpoint 112 from August this year from that feisty lady, Joan Rutherford, who's basically looking at the arguments for why people are not doing M42 and basically knocks them all down And, you know, the message is, for goodness sake, let's get on with it. Housing that was accessible and provided enough space for small adaptation would be, I think, one of the greatest contributions anyone could make to our current aging society. And trying to influence the debate about current housing is also part of our very ambitious agenda, as indeed is the issue of care homes. Not necessarily where any of us will project ourselves forward, but nevertheless, it may be something that we need to consider. And again, it needs to be something which is more than adequate. It needs to be something which creates happiness, comfort, and new possibilities for community and friendship, as well as care. In all of this, we need to not lose sight of affordability. Again, from the Housing Taskforce, a lot of people were saying, well, this retirement housing is all well and good, but I couldn't afford it. A lot of people are living in a fairly respectable 3-bed semi, but what they would get for it would not enable them to move into the housing which is available locally. So there's no point in providing housing which remains out of reach for people. But it may be that we need to explore different tenure options. Is home ownership in that situation the best model for people? But as with all of our housing issues, we can't new build ourselves out of this. Most of the housing we will ever have, we've got it. We're already living in it. So the big elephant in the room is a retrofit. Whoa, is that a big one? And when you're living in a nation where most older people are homeowners, you think, right, what do we do? Is this about more money in disabled facilities grants? Do we need to grant aid, more work by older people? What's the political acceptability of that? There's a lot of things to be teased out, but we need to invest in what we have. Next slide, please. The other part of this, and again, Sue has touched on this, is the issue of technology. And again, we are building on a basis of our own work here, Vivensa's work, with the Housing LIN, what's called the TAPPI projects, which were run by Professor Roy Sandbach. And again, promoting the agency of older people. Older people came up with the this framework that technology needed to be safe. And there's plenty of reasons to be worried about that, isn't there, when you hear about hacking and all of these things, people being scammed, needing to be safe with your technology as well as technology that makes you safe. It works both ways. Technology which is affordable to people, not just creating new inequalities between those who have a lot of money or whose sons and daughters have a lot of money and those who are reliant on adult social care's purchasers to get something adequate for them. They need to be supported in using that technology, and it needs to be seamless and easy. I always think that technology needs to be normalized. I did a piece of work a few years ago, and what older people really liked was the Alexa, because anybody could get one. It was cool. Your grandchildren could think, ooh, but it had so many functions. Call my daughter. When's the number 38 bus due? Play some early Beatles so I can have a dance around the kitchen. All of those things are enabled in that little box. You might need someone to set it up for you, but it works. So again, involving older people in technology which is normal, not stigmatizing, doesn't make somebody look like a frail old soul, and is affordable to people. And I've mentioned here on the slide the Internet of Caring things. This is a project of a smart house run by the National Innovation for National Innovation Centre for Ageing, which is in Newcastle, and they're working with Bernicia Housing Association to create a smart house. Now, not everybody will want everything in that house and might not want it packaged in that way, but those kinds of projects give people an opportunity to think what is possible, or as Sue has said, the shape of things to come, and enables you to have a try out. Would that work for me? Next slide, please. Actually, keep with that a moment. Just wanted to you know, some authorities are really kind of got the bit between their teeth. This is Manchester. We need accommodation that's care and technology ready. The facilities to have telehealth and telecare installed at a moment's notice. This is Sevenoaks. New housing must be designed to ensure it meets the needs of an ageing population and remains fit for purpose long into the future. Some local authorities are already thinking about that and are trying to promote that with developers in their own plans. So we're not starting, you know, the door was already half open. What we need to do is to build on this commitment and spread the word. Right, new slide, please. Ah, right, thank you. The third part of this, of course, is community. You can give somebody the best house there is, accessible, adaptable, with technology which is supportive and increases people's quality of life. But what you don't want to give them is an accessible prison. People need to be located, housing needs to be located with facilities, with the opportunities of being in friendship groups and paying attention to one's everyday needs in an independent fashion. And the slide I brought up is from that well-known framework, the World Health Organization's Age-Friendly City. And I like this iteration of it from the Centre for Aging Better, or Aging Better, as I've nicely put on the slide, which is that if we want to create places which work for everybody, then this is everybody's responsibility, not just the planners, but it's, you know, library services, National Health Service, shops and cafes. Everybody needs to be on board. And sometimes, of course, we get it right. 15 and 20-minute neighborhoods where we are having that density of everyday amenities so that you can have a good near reach for people with limited energy. You've got a sustainable community. You've invested in the local economy and you've created a bit of a buzz about a place. What is not to like about that? But other parts of community, of course, are much more central to our idea about shaping the future. And again, Sue had already mentioned this about co-housing. In co-housing, older people's agency drives it forward, and that might be issues about the design, might be issues about the management, the regime of it. But the voice of older people and the aspirations of older people are driving that forward. So this brings me back, if you want, to my first point. Let's keep older people at the centre of everything that we're doing and not get too far away from the things that they feel are aspirational and important to quality of life. So, thank you for your attention.
Rose, that's fantastic. Thanks very much for covering such a broad subject so in such a concise way. What you may not know also is that one of the founding sort of leaders on HAPPI, who alongside myself and a number of others, but spearheaded a lot of this work, is our next speaker. So I'm really delighted that Kevin can join us. At that time, he was program leading this and the VOPAG group at the Homes and Communities Agency, now called Homes England. And Kevin, you're probably reflecting back that it's not quite 20 years, but also more recently, Appleby Blue that Susan referenced won last year's HAPPI Award. And indeed, this year, touching on some of the co-housing points that Rose talked about, Hazelmead won this year's Housing Design Awards. So it feels to me that thinking both around age friendliness, but also intergenerational living is becoming much more to the fore. And thanks very much at short notice joining us to reflect on this. And also as a member of the all-party parliamentary group inquiry panel on creating intergenerational community. So Kevin, over to you.
Thank you very much, Jeremy. I did do a very quick check that it was 2009 HAPPI, because I thought I'd lost 4 years of my life since we project managed that report, but it's great to see it having such a great impact so much further on in time. Are my slides showing okay?
Yeah, we can see those.
Perfect, thank you. Okay, so today I'm going to share some of our experience in Ebbsfleet. Those of you like myself who are a bit of healthy Newtown and Newtown nerds might have heard of the 12 new towns being published or announced by the Newtown Taskforce in the last couple of weeks. So a very exciting time for people who are interested in building whole new communities, but a really exciting challenge to think about how we design for older people in new places, and importantly, how we allow older people to age well in place in these new places, and obviously avoiding some of the mistakes of the previous new towns and building on that. So I'm quite excited to share our experience in Ebbsfleet over the last few years, the good and the bad of that, and also particularly in relation to us being a healthy new town. The Healthy New Town programme was launched by NHS England 10 years ago, almost exactly, and it identified 10 pilot locations like ourselves to try and study some of those key elements about can we invest in placemaking from its earliest concept to make long-term savings to the NHS and have a better quality of life for the people living in these places. So the largest of the 10 pilot Healthy New Towns was Ebbsfleet. This was our overall programme. Our programme was a collaboration between Dartford and Gravesham, what is now part of the Kent and Medway ICB, or the Clinical Commissioning Group then. We worked very much with them, Kent County Council and others, to come up with this idea of what work streams, what outcome drivers should drive our healthy new town. You'll see in the orange box I've highlighted the living in your home for longer, and the whole concept, if we design for older people, we design for everyone, was central to our healthy new town concept. As part of the overall programme, we had an Aging Well in Ebbsfleet partnership. Now that was led by the Director of Adult Social Care for Kent, with also the Directors of Public Health, our local authority partners and others who really started thinking about how can we design a new place so people can age well here. People perceive new towns being around new young families, and often that is the case. But we're finding older people are following those younger families, and actually many of the barriers that there are to older people are the same for young families. So aging well is part of our overall strategy. I've highlighted through the middle of our we had 5 work streams. One of those specifically was looking at intergenerational housing. Now we did, as a first stop, think about need and demand. We worked with the HousingLIN on that. We've developed neighbourhood plans in terms of the principles of good neighbourhoods and homes for healthy ageing. We've looked at technology, but for today, I'm just going to concentrate on this idea of intergenerational housing. Now, the reason we looked at intergenerational housing was because the HousingLIN had done some needs analysis for us. They used their SHOP model, and they didn't look just at the Newtown area of where Ebbsfleet sits between Dartford and Gravesham in North Kent, but also looked across a wider geography of what the need for housing was in our location. Now, they identified an opportunity for HAPPI style housing. HAPPI's having a good role today for that aspirational downsizing, right sizing type housing product. We also worked with the local health board, the NHS Trust, and they identified needs for affordable housing for key workers in particular, and step up, step down transitional housing. So we identified these needs, these demands. We then commissioned Sir Wigglesworth Architects to work with us to develop, well, what does intergenerational housing mean? Because again, our Aging Well in Ebbsfleet board or working group decided that we didn't want to have older people in ghettos. We want to support people at home for as long as possible, and where the people do need to go into a specialist housing product, it should be something more about mutual support intergenerational housing. This quite complicated looking diagram really sort of sets out what we developed, but it simply means we needed to listen. The roots of intergenerational housing are the people who are going to live here, what their needs and demands are, and we had to look at the opportunities of a new place and how we marry the two together from a top-up, bottom-down approach with intergenerational living at its heart. Today, I'm really sharing this concept. We haven't completely built it yet. We've developed a concept, we're developing a business case. But what we tried to identify through Ebbsfleet was what is intergenerational housing in a new place, in the Ebbsfleet context. A lot of people think intergenerational housing is just ordinary placemaking, and in many cases it could well be. In our context, we've got these 9 points of the sort of 9 principles of intergenerational housing. So we are saying it is a specialist housing product. It will complement the mainstream housing offer. It should bring together a number of compatible types and tenures of housing. So it's not just specialist housing for older people, it brings in complementary housing users. And that's really, really important. We encourage a mix of age groups. Really central to intergenerational for us is this offering an opportunity for mutual support. So it's not just living in a home alone, it's there's something within that home and that neighborhood that gives you mutual support. It's based on HAPPI principles, that is to be in the right location. It should offer access to care when needed. And really importantly, again, it should have a long-term and continuous management approach. So we've developed this into a model. The specific model that we're developing currently is for a development of 138 intergenerational homes. That will be a mixture of 50% private for sale, 25% shared ownership for older people, and 25% private rented sector for health workers. There could be many other combinations of this. This is the model that we're currently testing. We are proposing to put this intergenerational community in the form of 2 towers within a health and wellbeing quarter, which will be at the centre of Ebbsfleet. For those of you who don't know Ebbsfleet, it's in North Kent. The high-speed line between London and Paris goes through Ebbsfleet. There's a major station there. And we see this new community being right at the heart of that new town that will evolve within the city centre. It'll have access immediately to a health and wellbeing hub, and also have key worker housing adjacent to it, but very much a community at its heart. So our intergenerational housing concept we're developing has looked really at 4 scales. It looks at local scale, village scale, city scale, and the neighbourhood scale. So the city scale, this intergenerational housing community sits within that overall health and wellbeing hub in the city centre. And then on a village level, we have 2 towers, each of the towers with 70 to 80 homes. Within each tower, we have a series of neighbourhoods. They share communal facilities on the ground level and communal facilities on the roof level, and then they have direct access to some of those intergenerational and health and wellbeing facilities like leisure, health hubs at the base. Now, on that individual floor level, we have groups of 7 to 9 homes. So that's almost the local neighbourhood. That's where people get to really know their neighbour at that level. And then within a neighbourhood of 25 homes, as you can see here, there's almost stratifications of 25s going vertically in the towers. They share a winter garden, guest suites as well. So you have the very local 5 to 9 homes, the neighbourhood of 25 homes, and an overall tower village of 75 homes. We've been looking at ways of how we mix those to get that mutual support. Some of those things we've been considering is what's the acceptable sort of tenure mix that we might look at. So we've looked at pepper potting, mix of neighbourhoods. We've looked at stratification. At the minute, we're really sort of exploring that idea of neighbourhoods, with each neighbourhood sharing the hub, the sort of winter garden, and also then having shared ownership for older people and other private housing within those hubs. Importantly, this is a concept, so we have to develop a business case to go with that. And again, HousingLIN have been so instrumental and helpful with us in terms of giving us the demand and need analysis, helping us develop intergenerational as a concept, and also helping us with our business case development of what's the additionality of putting health, housing, and social care together within one community. Now, their report has actually showed us that there could be over £7 million of savings by taking this approach across the different areas that I've shown below in terms of self-commuting workers, healthier communities, saving to the health service. Now, this saving doesn't have to necessarily come to us or to the community or to the owners. So it is about savings to UK PLC. But a really important, I believe, concept, a really important lesson for us that we are now going to work with developers across the UK, trying to see if who will want to work with us in partnership to deliver this interesting innovation. So this is where we're up to at the minute. watch this space in terms of where we get to in the future.
Kevin, thanks very much for a real whirlwind overview. But actually, you've hit key points there, which I think will resonate not just with what Sue and Katy set out around the SHAPE program, but also taking the impact around that social value. And I think there may be a conversation to be had with us around that and how that can be really embedded in the program as a fundamental plank of SHAPE as well. So that's a conversation I'm sure we will take forward. So thanks again for that, and look forward to catching up with you in due course. Paul, we've touched a lot on new build, new create communities, but actually we also know, as Rose pointed out, we also have an ageing housing stock. We have a number of people who need to either adapt or improve their existing home, people in fuel poverty, people wanting to think about energy efficiency as well. We want to hear from you about where you think the sector's moving and how we can shape the agenda with foundations as well.
Great, thank you, Jeremy. I kind of woke up this morning. I'm at an event in London today, and I was really pleased to see a report pop into my inbox from Age UK, who've done some research work with older people across, I'm not sure if it's across England or the UK. I haven't had a chance to read it properly yet, but I think it's really good to see that a report that recognised the fact that over 85% of people want to remain in their own homes and in their own communities rather than moving into specialist or retirement housing. And that made a number of quite key and I think very sensible recommendations to build on others that have gone before it. So if anybody's I'm looking for a really, I think, authoritative report around some of these bits and pieces, I'd very much recommend the Age UK report that came out earlier today. But and if it had come out earlier, I might have included some of it in the presentation. But what I was going to talk about was some developments and challenges, particularly around home adaptations. Key developments, I think kind of fair to say that over the last probably 14, 15 months, a lot more has happened around home adaptations policy than happened in probably the previous 14 years. There's a lot happening at the moment. So some of the key things just to make sure everybody's aware of. One is that the upper limit for the Disabled Facilities Grant, which pays for home adaptations in England, had been or has been at £30,000 since 2008, but that has been reviewed. We're waiting to hear the outcome of that, but that has been actively reviewed by the government, and we should get some information on that hopefully later this year. And also the allocations formula. So this is the formula that the government uses to distribute what's now 711 million across the 294 local authorities in England. There's a proposal for a revised allocations formula that's been out to consultation, which closed last month, but hopefully that will be in place for the 26-27 allocations, which should help to ensure that that 711 million goes to the places that need it most across the country. I think it's fair to say that the existing allocations formula is almost as out of date as the upper limit, and I think it's in ways been more problematic in terms of reducing the amount of money that some local authorities have to spend. And then the third one, which has been announced very recently, is that there's going to be a large-scale study of the impact and return on investment on disabled facilities grants that will build on the evidence base established from what's called Bath Out 2, which is a randomised controlled trial that looked at the of replacing a bath with a shower and showed very positive return on investment for both public sector and private individuals of actually having a timely adaptation in the bathroom. So we're hoping to see that this large-scale study over the next probably 3 or 4 years will look at other types of adaptation and kind of compare and contrast the different returns on investment for different types of adaptation and inform the future of the Disabled Facilities Grant over the kind of medium to longer term. In terms of key challenges, and I think these are things that I'm kind of aware of, but sometimes are kind of secret truths and get overlooked for other agendas. And I think one of them is around social care. We know that social care is being, again, reviewed at the moment with the Katy Commission. But I think it's kind of common sense that if we want to keep people living safely in their homes and their communities, then home adaptations have to be a key part of that. And sometimes see that kind of social care is discussed without considering the impact of housing and adaptations and repairs and improvements as kind of part of that mix, because it's going to be impossible to keep as many people as perhaps the ambitions are for within their own homes if those homes aren't suitable for them. I think the other one is around social housing, and I've spent quite a lot of time talking about it this year, but it's again a fact that over half of all social housing tenancies are home to somebody with a long-term health condition or disability. But quite often those homes and services are designed for the fit and well minority, not what's actually the majority of households where there is somebody with a disability or long-term health condition. And we're going to be holding a conference next year to look at adaptations in social housing. But I think it's key for all social housing providers to kind of realise this kind of basic fact and think a bit more about how they contribute to the adaptations of homes, and also how they provide services for people who need them. And then I think the third one, which I've kind of termed public health, although it's probably got a broader application, is that home adaptations tend to be thought of as a short-term welfare fix for the current person that needs it, and it often done as cheaply and as kind of as almost as ugly or clinical way as possible, in the thought that they'll be binned rather quickly, and certainly not looking at the long-term improvements in accessibility that could, if those adaptations were left in place, could prevent somebody else having a catastrophic fall in the first place. And there's good evidence from America that surviving spouses of somebody with a disability who kept the adaptations in were much less likely to have a catastrophic fall afterwards. I've been at an event today where Procare and Invisible Creations were talking about their much more aesthetically pleasing grab rails, and that actually that they've been working with a contractor in the southeast, not too far from where I am now in London, who had priced up a bathroom modification or bathroom adaptation with nice looking grab rails that kind of blend into the background, with wall boards, with nice sanitary ware. And actually you can do that. They'd actually worked out that it was cheaper than the kind of traditional white tiles, white grab rails. That is the kind of the what I suppose what you would think of maybe as the traditional DFG type adaptation. So I think there is a change in what manufacturers and suppliers can produce, with Invisible Creations leading the way on that. But I think all too often we do still see white tiles, white grab rails, white sanitary ware, which, as well as looking clinical for people with visual impairments or dementia, can make the bathroom quite difficult to use. And then finally, I wanted to end with some opportunities. And there's quite a few things I could have picked, but I wanted to emphasise that it's not just kind of waiting for government to make change policy or bring additional funding in that can make a difference. And I want to just highlight three things that we're trying to do to shift the needle on this and create a better environment for existing homes. So one is the Home Adaptations Advisor Network, which is something we're just finishing setting up. But the idea is that people like Age UK, Citizens Advice Bureaus, other kind of third sector and disability groups provide advice to people who might need home adaptations and to apply for grants, but don't necessarily have the full understanding of how the legislation works and what might be available. So we're going to be offering free training and free peer-to-peer network system, so that they can get the information that they need, so they can provide much better advice and information to people who may need to look at adapting their home. something we've already set up is the Home Adaptations Installer Network. And this is around developing and growing a skill group of contractors that are experienced in adaptation work from a technical perspective, but also have a kind of caring approach, which I think is kind of the key combination for doing this sort of work. So it will be available for use by local authorities. So about 40% don't currently have an accredited list of contractors to do home adaptations, but crucially, it'll also be available for members of the public who may want to self-fund or use other methods of funding adaptations in their own home. So it'll be a national network of contractors who have skill, expertise and a caring approach to this kind of work. And then finally, we've seen that there's, in too many areas of the country, there's long waiting lists for social services assessments for a variety of social services services. But quite a lot of the people on those waiting lists actually just want to share a stair lift or a ramp, fairly straightforward home adaptations that don't really need a full social care OT assessment. So working with the OT service, we're rolling out trusted DFG assessor training so that people like caseworkers, technical officers, housing officers can be trained to safely and competently assess things like ramp, showers and stair lifts, which then means that those people don't have to wait on waiting lists, which can be over a year in some cases, and also frees up specialist occupational therapy expertise for the more complex cases where they're really required. So just kind of 3 examples to finish with of things that we're trying to do that are kind of practical and make a real difference for people.
Paul, that's great. Thanks very much for that overview and also giving us some real insights into specific things that are being done, both in terms of tackling sort of increasing awareness around inclusion, both inclusive design, but also intersectionality between ageing and disability and diversity. And I know you're also a member of the, along with us, the Inclusive Living Alliance, and it's great that we're seeing a gradual increase in awareness around that. I'm conscious we're sort of fast approaching 5 o'clock, but we do have some really sort of key questions still in the Q&A box. And if it's okay with people, our contributors this afternoon, if I could just quickly go through those, and perhaps we take 1 or 2 of those for sure. And I know some have been answered already. So again, if we can sort of just kick off saying, there's a question from Lee. If I've got this right, about I'm really interested where data was sources for planning for implementation locally, and something about supporting and how we can support and learn. So this is the whole thing about the SHAPE program. We want to develop different approaches, no one size fits all style of nature of sharing information and content. Any thoughts about that?
Yeah, I think it's going to be key. I mean, there's lots of information, as I said, around already, and it's about curating that well. And about sort of spreading the knowledge about where it is and where to find it, and you know that's why we're working with you at the HousingLIN, because you know you're pretty good at this, but we need to make sure it gets out to even more people.
Thanks, yeah, and you know, this is again at the heart again of what we're about and what we're going to be taking forward with you. I think there's a couple of questions around for Kevin. I think there was one around what determines a care-ready apartment. I think you may have answered in the chat, but just for other people who may not have seen it, do you just want to quickly say what you put in there?
Yeah, what I'm saying is that we've developed a conceptual approach. We'll then be trying to procure developer partners, specialist developer partners who will work with to develop up the detail of that. We are still really searching out for whatever good practice, any other expertise other people have that will go into our brief to make sure we get the right partners. We do require M42 for all housing in Ebbsfleet now, even though there wasn't anything within planning previously. The good work that the HousingLIN did in terms of showing us need and demand has made that Dartford Borough Council now required in their local plan. And we are looking for, again, a baseline, probably be M43 as well for this housing. But we realise it needs to be more than that to be care ready and be very specific. But remembering that our intergenerational housing is going to be mainstream, it's not very specialist. It's not, care could come to people in their homes, but it's not meant to be a very specialist product. But again, it could be 5 years before we deliver this, and technology is moving on so much, so quickly, that we need to really just be adaptable to that and know what's going on, rather than trying to define exactly what that is at the minute.
And Sue, I think I saw your hand up. Was there something you wanted to add?
Yeah, I was just going to add, and don't ignore some great sort of research that's going on in universities in partnership with community organisations. So, you know, I know you said it wasn't specifically specialist. You were talking about, Kevin, but actually there are some fairly basic things that you can do that make things a good design for, you know, dementia ready. So, you know, there's great work going on at Stirling University, for example, on this. So, yeah, it's taking that into account as well.
So just to go on, I mean, Ian Johnson sort of challenges some of our thinking around I suppose, issues around how some senior executives are on high elevated pay packets. But I think the point you want to make really is about how to engage more on a co-productive way. And I wonder, Katy, if you had any thoughts around that.
Yeah, absolutely. I mean, I think it's really important to start with working with execs, CFOs right from the start. My experience is that often they want to be part of the design and the innovation. They don't want to necessarily be the ones to stop things in its track. But I think it's about finding those that want to do things differently at first. Like, we're not going to shift everyone all at once, but I'm really confident that we can find some forward-thinking senior executives that want to take this leap of faith with us. And then I think it's about a kind of coalition of the willing. So I'm hopeful we're going to get fantastic sponsors in these test beds. And then I think it's about working together to kind of perhaps shift the mindset of some of the laggards.
Yeah, no, and that's at all levels. This is both, you know, I think as Sue set out, you know, we have the learning environment where we want to sort of co-design and co-produce, but also the leadership sets as well. This is not just about seniority. This is also about the people with lived experience and their senior experiences as well. Rose, are there any other points that you want to make? You're muted. No, yeah, there we are.
Right, yeah. I think, as other speakers have said, your key in our shape work is the issue about leadership, and you've already mentioned this, Jeremy, but I suppose what it is people who not only have vision, but who are prepared to learn, so that we all turn and learn from older people, that we all learn from each other. And I do like the expression coalition of the willing, clearly being hijacked in all sorts of other ways more recently. But I think also one of the things that propels people forward is, you know, the idea of examples. You think, oh, they are doing it. What's their experience? What does it cost? How do people do it? Wanting to learn from the detail. And I think having those kind of organizations to benchmark with, I think, can propel a lot of people to start joining that. Not everybody wants to be at that arrowhead of making the change, but a lot of people, I think, would want to follow. We just need to find the people who want to come out there first and who maybe are already doing good work.
Thanks for that. I'm going to just go finally just sort of address two questions. One was from Emma, who talks about the DFG and people working in housing balancing the need for DFGs for those who were also having to think about others without adaptations. Paul, are any thoughts around that particular question, if you've had a chance to look at it?
Yeah, I think it's around perhaps having a different mindset, and I think kind of it links to what some of the other speakers have been saying. It's and kind of what Jaquel's also added to the Q&A thing, is that it's kind of improving the accessibility of the housing stock more generally over a period of time, and not just putting in kind of a cheap grab rail or a cheap share adaptation now that gets ripped out in 2 years' time because it looks awful and the next tenant doesn't want it. It's about kind of thinking about how you can design bathrooms and other parts of dwellings so that they suit a much wider spectrum of people. I think quite often we build retirement housing that has all the grab rails, all the handrails, all the alarms, all the kind of accessibility features, and then we build general needs housing that has none of that. And we've got to meet somewhere in the middle somewhere that makes sure that the vast majority of housing meets the needs of the vast majority of people, I think.
Yeah, and I know you're working on sort of reviewing the adaptations without delay, and I'm hoping that there'll be some really good examples of that coming forward. And Jaquel, thanks ever so for signposting to the Inclusive Housing Design Guide, the Bible in this area, if I can be so bold to say. And perhaps Sally can put a link to it in the chat box. And I think we'll just finish with one final question, I think, which is probably around the new towns again, Kevin, which is about creating aspirational places. And you talked about the sort of the hub there. Anything about that sort of tenure diversity and about private renters and how looking much more around that right placing across all tenures rather than just sort of pepper potted across the developments?
I think one of the questions Alison posed to me in the chat was exactly around that intergenerational is about levels of affordability as well. And I think that's something that's core to our intergenerational concept, is that mutual support doesn't come from everyone being the same, but by having a variety of tenure types and a variety of affordability, really, that it's a real mixture of people who will support each other. And I think that's really important. So the number one thing of our Aging Well and Ebbsfleet working group was avoid ghettos. And that's often the result, whether it's a social housing ghetto or affordable housing specific approach, or whether, as many of the former new towns have ghettos of older people on the edge of the new town now because they didn't think about older people at the beginning and they've ended up having to think about them later on. So we absolutely want to avoid that. And that's why our intergenerational housing concept's literally hanging over the train station. It needs to be at the right of the heart of this new town. So and that's why I think if we think about designing for older people from the beginning of the new towns, we think about everybody rather than as some of the former new towns after the war. In the millennium, there's a whole raft of extra care villages in new towns. In Telford, there's an awful sign I have a picture at home of where it says cemetery and extra care village on the same sign at the edge of town. And it's just, don't do that. Let's think about everybody, design for everybody from the beginning in new towns, and think about not just new people moving there, not just young people moving there, but everybody and how they're going to live there for a long time, really. I think that's the key to it.
Well, look, on behalf of the HousingLIN and the Vivensa Foundation, can I thank you all for joining. I'm sorry we've overrun by nearly 10 minutes, but I think the importance of this area, the partnerships we're developing going forward, not just with Vivensa, but also all of you in terms of really helping the thought leadership, but also more importantly, having the opportunity to practice this through the test beds is going to be really important. Watch this space, as Sue says. We want to take this forward collegiately, collaboratively, as you know. As Sally mentioned right at the outset, the slides, the recording, the chat and the feedback will be available tomorrow. Do look out for that. Can I thank her and the team behind the scenes for setting this out, especially at such short notice. And if this is your first happy hour, we normally run these every Tuesday afternoon, and we've got another one next week, which actually is going to challenge us thinking around affordability for age-friendly communities. We're being joined by Dr. Hannah Marston at the Open University, who's been thinking about this and has written a paper for us on affordability based on the new book that she has. And we're also being joined by Ian Scott from Edinburgh University School of Architecture, and by Bolton Age UK to give a practical example about how, at a local level, the local community is very much part of Bolton Council's age-friendly status. So please join us next week if you haven't already registered. And can I thank again all the speakers who've joined us at very short notice, some even shorter than the others. You've all been fabulous, and look forward to working with you going forward. Thank you.